If you've started to have some neck pain or stiffness, it is important to get on it as soon as possible. The reason why is that pain and stiffness can lead to bigger issues over time if left untreated. Many people start to notice that they have some difficulty checking their blind spot or some limitations of motion, and they don't do anything about it initially because it's not that big of a problem, but it can lead to bigger problems, including joint damage, disc damage, decreased motion, and even more pain. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I am empowering women with changing bodies to move pain-free. And many of the women I see in the clinic who have neck pain or headaches or migraines or difficulty taking a deep breath all started by noticing that they had some decreased motion years and years ago, but it didn't actually keep them from doing what they wanted to do. So like every other human ever, they put off dealing with it. Because let's face it, as humans, we only deal with the pain when it is causing issues that impede us from doing what we want to do. However, I am here to encourage you that you do not want to delay on treating any neck stiffness or pain that you feel, because we don't want it to become a bigger issue over time. A lot of times the muscles will start to get tight. It may be a postural issue. It may be due to some activity you do. And over time, this can lead to bigger issues that become more difficult to solve. So we want to deal with those issues when they're small. Now, the exercises I'm going to show you today are all rotation-based. And a lot of people ask me, why do I start with rotation? The reason is pretty simple. It deals with the joints and it deals with the disc. You see, the joints need the rotation throughout the entire spine in order to get the proper nutrition of the cartilage, which lines the joint. So if your joints are moving correctly and your cartilage is getting nutrition, this will decrease your risk of arthritis later on in life. The other thing is the disc. So the discs need rotation in order to do a process called imbibition. Imbibition is actually how the discs get their nutrition. You can think of it like a sponge. So when you rotate, the discs tighten down, and like a sponge, when you squeeze it, everything comes out. And when you derotate or come back to neutral, looking straight ahead, it plumps back up and it can suck up all that nutrition that's around it. Which is why I really like to focus on rotation through the pain-free range, because it's gonna help the discs as well as the joints. Now, please notice, I said pain-free range. All of these should be done without increasing your pain. You may have a stretch sensation, that is okay, but it should not increase your pain at all. So do not progress to the next exercise if you are having any pain with the first exercise, and decrease your range of motion until you can do it pain-free. As you do more reps, your motion will improve and you'll be able to tolerate more and more motion and then progress on to the next exercise. So first off, we're going to start with just an active range of motion that's called rotation. So to do this, you want to make sure that you're in that good sitting posture. So your head is over your shoulders are over your hips, and then you're going to turn and look over your shoulder as far as you can without increasing your pain. Now you're going to do this slow and steady. You don't want to make yourself dizzy while you're doing this, and you're going to go from side to side. You want to go as far as you can pain-free. If you feel like, oh, I feel like I want a little more stretch, you can apply gentle overpressure to your jaw to help you get a little bit more motion, but don't push yourself into a point that's painful. You're going to do 15 reps of this to each side, slow and steady. Now, if you feel like that's actually pretty easy for me, I don't really even feel like I'm getting a stretch, then the next exercise is for you. For this one, what you're gonna do is bring your head forward, looking down towards your belly button, and then you're gonna perform that rotation again. Now, it's important to note you will have decreased motion when you do it this way, Because you're taking out the motion in the lower cervical spine and only doing the motion through the upper cervical spine. That's actually what this stretch is designed to do. So understand you will have less motion, and that's completely normal. And again, it should always be pain-free. So what that looks like is you're going to look down towards your stomach, make sure this is pain-free. Then you're going to try to look up towards that shoulder, slow and steady, and over towards that other shoulder. Again, pain-free motion, just go as far as you can pain-free. And if you need a little overpressure, again, you can apply a little pressure through that jaw to help improve the motion. This exercise you're also going to do for 15 reps to improve the joint mobility as well as provide some nutrition to the disc. Now, if you find that both of those stretches are not quite doing it for you, this one will give you a little bit more stretch as well as giving you a little bit more support to do that overpressure, which is what we do with the hand. So you're going to take a hand towel and you're going to grab it from the diagonal corners. So diagonal corners, you're going to put it behind your neck, like you're creating kind of a cuff behind your neck. And then you're going to grab, so for left hand, I'm going to grab the right corner. The right hand is going to come grab the left corner. So I'm going to grab the opposite corner and I'm going to bring this towel around. So I'm going to be performing right rotation here and I'm getting some overstretch and some good rotation through my neck, but you're just going as far as you can comfortably. Now for this one, you're going to want to go to one side and then you're going to switch it up. So if you want to do left rotation, you're going to switch your hands. So the left hand will now be on the top, pulling on that left corner. The right hand is stabilizing down here, and you're going to provide some gentle overpressure to increase the stretch through the neck. Now, after you've performed the stretch that works best for where you are right now, I want you to make sure you follow that up with a couple of deep breaths, at least 3 to 5. Now that we've got the neck and the shoulders moving better, we want to make sure that we activate that vagus nerve, which goes through the diaphragm, by doing some deep breaths. That will allow our entire system to calm down and reset. So make sure you're doing 3 to 5 deep belly breaths, breathing in through your nose and breathing out like you're blowing out a candle. This will help to reinforce everything that we just did and leave you feeling less stressed with decreased tension. Now, if you are currently struggling with neck pain, I'm going to encourage you to check out the link in the description box below where you can download our free neck pain guide and have tools on hand that you can implement today.